Good afternoon. My name is Dr. MattieKlare. Welcome to the show Dr. Klare Explains. Today's topic is handling about the chiropractic profession when you would need an adjustment. How do you know that you have to see a chiropractor and you would need an adjustment? And that's a common question even by those individuals who are seeing me in my office, and they feel that they are out of alignment, but they're still not secure enough to know when should I see you again. They ask me again and again this question, and I would like to be very honest about this. And as we know, chiropractic adjustment is always needed. Well-aligned body is the base for everything functioning in life properly, the highest level we can. If the nervous system interferes because somewhere joints are not properly movable in the body, especially at the spinal segments, the tiny little spinal joints, then we have this negative influence. We are more suppressed in our performance, maybe more stressed, having less patience for our purpose or what we're supposed to do for each other, and even can get sick or feel unease. Even sleeplessness can relate to being misaligned, and tiredness and achiness in the body, and doesn't even have to hurt anything, but simply feel not the best, and being not able to perform the best, and just being a little tired. That already I hear all the time reported. Oh, I feel so vital now. I feel life coming back into my arm, into my head, and suddenly my entire body is like vibrating in a good way. I feel really life in my body, and those are actually really effects by individuals who start relating more to the body and feeling it more. And that's actually a basic importance, that we start also to listening to the body more than just feeling pain and go for help to be able to fix it and then go on again. So we just simply take too much for granted that the body is functioning, and then are very impatient and cannot deal with it when suddenly failing and somewhere is hurting, or we cannot walk properly because the foot is just simply not rolling up properly, and it doesn't even have to associate with some pain, but just simply changes the gait. And most of the time we don't even recognize it. Somebody else see it, you're limping, or doesn't make the same step, same longer step, and that can relate to the motion of the foot itself and the joints in the foot and the ankle joint, or can come higher up from the hip joint and the pelvic joints, the sacroiliac joint. The pelvis, the pelvic cavity is actually shifts in itself a little bit, and that can make the gait already a little bit shorter on one side, and on the other side stays at the same time normal. And this leads then higher up again to lock up something else in the spine, goes up to the thoracic cage, and then suddenly the head not moving properly, not the same way to the left or the right. And how we recognize this? Yeah, we have to a little bit listen to our body more than just recognizing pain. Really feel how you can turn your head by driving, for example, a car. It goes easier to the right, and suddenly you want to look to the left, turn the head to the left, and then suddenly that's a little bit less. So in order to be able to have more awareness of the body and figure those tiny little changes and this things, we have to move the body. And the number one, what I recommend, light motional exercise routine And still people who I teach in my office one by one, they still tell to me, yeah, I did all the stretches. And I have to correct it again. Those light repetitive motion routine exercises that I'm teaching, it's not stretching. The stretching, it's a total different issue. I go back again and emphasize in every show we talk about chiropractic exercise, we talk about range of motion, posture, movability. I always emphasize number one is the movability and how we can be movable enough if we constantly repeating certain motions. So we have the hygiene for the body, we have the hygiene, brush our teeth at least morning, evening. Why we don't take care of the spine and our body the similar way? So I call it spinal hygiene. And doing those tiny little routines and motion exercises, they showing us then like a self-diagnosis in that term, that in some directions we just don't move as easy than in other direction. And that's definitely, although we don't have pain yet, it's an indication to see a chiropractor and get well aligned, get adjusted, and get motion restored in those joints that they are relating to that range of motion decrease. So again, the number one is the range of motion. And to keep the range of motion the best we can, we have to still move it and move it and move it. Don't just use the body and make it functional, fulfilling the purpose of go shopping and prepare food and eat a dinner and watch TV and write a paper or go on the computer, on the internet, do daily life activities. Or walk the dog even, that's not going to be enough. We need a little bit more. And it doesn't mean we have to go into the gym and exercise for hours, which of course it's very advisable that we keep the circulation going, and circulation is the basic health for our blood flow and the entire circulatory system, which is number one cause of death. Still heart disease and failing of artery or kind of